Hello everybody, so today we will be discussing the trigeminal nerve and its divisions. So the contents of this video will be starting off with the general anatomy of the trigeminal nerve, then going into detail in each of its three divisions, so the ophthalmic, maxillary and mandibular, and then covering the motor function of the nerve, followed by the references and how to contact us at the end. So beginning with the basics of the trigeminal nerve, it's our fifth cranial nerve and you have two of them, a right and a left. It originates from your brainstem, specifically the pons, which is located between the midbrain and the medulla, and they are the largest of your cranial nerves. So they run from the pons to near your temples in front of your ears, where we have the trigeminal ganglia. Here they divide into their three branches, which are the ophthalmic, maxillary and mandibular branches. The trigeminal nerve has both a sensory and motor function, but note that the motor functions are only associated with V3 or the mandibular branch. We have three sensory nuclei, one for each of the branches, and then one motor nucleus, which is specific to the mandibular branch. So the ophthalmic branch is our first division, and this provides sensory innervation to the top third of your face, so specifically the skin mucous membranes and the sinuses that are located here. So for the ophthalmic division, this will be the frontal and ethmoid sinuses. This includes your forehead, upper eyelids, and also the front bit of your nose. The clinical relevance here is that the corneal reflex, which is where you lightly touch the cornea with a cotton bud, and it causes the patient to blink as a reflex, is testing this specific division. The middle branch is also known as the maxillary division, and it provides sensory innervation to the middle third of your face, including the maxillary sinus. So more specifically, the areas here are the lower eyelids, the cheeks, the upper lip, the upper teeth, and then the side of your nose. The final branch, the mandibular branch, has both sensory and motor functions. So on this slide, we'll be talking about the sensory function of this branch, and it provides sensory innervation to the lower lip, chin, anterior 2/3 of your tongue, lower teeth, and the external ear. So as we previously spoke about, it also has some motor function and innervates some muscles. There are three broad groups, and we can put the muscles that the mandibular division of the trigeminal nerve innervates. The muscles of mastication, the muscles in the neck, and then one muscle in the ear. So the muscles of mastication are involved in chewing and general jaw movement. Specifically, these are the medial and lateral pterygoid, masseter, and temporalis muscles. The muscles in the neck are involved in neck movement, and specifically the tensor veli palatini is involved in equalising pressure in the ear and elevating the soft palate when you chew. And then the tensor tympani, which is a muscle in the ear that helps protect your eardrum from damage in excessively noisy environments. So these are the references used for today's video, and this is how you can contact us.